Hello everyone, I am Dr. Preeti Poghe and this video is about the result cases, like in case where you have stations and the patient's reports or results are put in front of you, and they are like either blood test or sonography test or something like that, and you have to tell them the report, right? So how to go about it? Because there are two ways of going about it. Some prefer going for the data gathering first, and some go for the results first or the reports first, right? So how to handle the situation? For example, if you have a patient who is not daunting on you or is not very much anxious and not asking you too many questions, is happy to answer your questions, then you may just quickly go with the data gathering, because whenever you're going to tell the reports to this patient, there has to be some relevance to it, because once you tell the report and then they keep asking you the questions, then you don't have much time for the data gathering. Of course, you can always say, now since I've told you the report, I need to tell you why, I need to help you with why it must have happened, and for that there are few questions that I would like to ask you, right? So you can go that way and go with the data gathering. If for some reason, because if the patient is questioning you every now and then about the reports, then of course you have to give the reports and then go to the data gathering. So remember, whenever there is a patient and the patient doesn't seem much anxious and you are able to go with the data gathering first, try and gather the data as much as possible in the initial 2 to 3 minutes, and then go with the report. But if the patient is continuously asking you about the reports, then don't keep the patient waiting. Always say that I understand that this is bothering you, so let me tell you the reports, and don't just say that there are only 2 questions left, there are only 3 questions left, because this is going to anger the patient after some time. So don't do that. You may just say that yes, there were few questions that I wanted to ask you before I tell you the report, but since you are very much anxious with that, I can tell you the report first, and then I may ask you the questions later, and tell the report, and then just say that since I've told you this, and now there are these few questions that I need to know the answers for, so as to go ahead, may I ask you that? Right? So there's no proper way of going with the reports. You may do it as the station is, right? So of course you have to be a logical doctor. You cannot have a protocol of how to go about things. Only the protocol is with the treatment. There's no protocol on how patients or humans are going to behave, right? So you have to go exactly according to how the station is. I hope this video has helped, and tell me if there are any more doubts or comments regarding the same. Thank you very much.